So let's say you have a health concern and you're trying to decide, okay, who do I need to go see? Do I need to go see my medical doctor? Do I need to see a surgeon? Do I need to see a massage therapist, physical therapist, or a chiropractor? Well, so what I would say is I would probably start with the least invasive. Okay, what's going to potentially do the least amount of harm, right? First, and then work your way down the ladder. So maybe the least harmful could give you the best result in the beginning, and then you don't have to worry. So let's look at drugs, right? Okay, so what's some drugs? Okay, well, every drug has side effects. Aspirin alone has like 17 different side effects. So there's some potential harm there. The side effects could cause you a problem, right? And drugs never fix anything. Nobody in the history of mankind has ever suffered from a drug deficiency that caused a certain health problem. So taking a medication doesn't fix anything. It just temporarily masks it. And sometimes they can actually mask it so that you don't feel it, but that's your body's warning system telling you, hey, don't do this because you're going to hurt yourself. So like, for example, let's say you had a lower back disc, right? And it's bulging, maybe it's hitting the nerve going down the leg. Well, the pain that you feel in the back and down the leg is your body saying, hey man, don't be careful. We got a bulge here. You move too fast, too quick, or you do something too impactful, you could rupture that disc and create a bigger problem. So taking a medication, even getting injections might numb it, but the problem's still there. And then you go and do the things maybe you shouldn't do, and you could create a bigger problem that the only option then is surgery, like a ruptured disc. So taking medication is an option, but it's not going to fix anything. Okay. Now surgery. All right. Well, there's always, you cut something out, you can't put it back in. There's always going to be scar tissue. Just low back surgeries alone, 50% of the time you come out from a back surgery worse or the same. So there's only a 50% chance you're actually going to be improved. So the odds aren't great. From a upper cervical chiropractic standpoint, the absolute worst result that we've ever had in 31 years in business is basically no result, meaning that we checked you, we corrected you, and nothing happened. Okay. And I'm going to tell you right now, God's honest truth, that's rare. Almost everybody benefits. Okay. So we're going to make sure if you've been here for a little bit and we haven't seen a change, we're going to keep figuring it out until we do. So start with the least invasive. If you're got any kind of health concern, it doesn't matter what it is. Start with something that maybe, that the potential harm is very, very low. And then start working your way down, because if maybe that doesn't help, then maybe your only option. And I've had people I've had to refer out for surgery because by the time they got to us, it was too late and there wasn't really anything we could do. So that's my advice. Just start with the thing that could do least amount of harm and work your way down the ladder. Hopefully that very first thing you try, maybe it's coming here, we can get you well and not have to worry about it. So wish you the best.